In the United States, the battle over vaccines and immunizations has reached the Pentagon. Defense Secretary Pete Hegseth has dropped a requirement that soldiers be vaccinated against influenza, that they get the flu shot. And the U.S. Health Secretary, he faced grilling in Congress this week from lawmakers who blame his policies for an increase in outbreaks of measles. DW's Janelle Dumalaon looks at the battle over how Americans approach what is key to public health.
A brief sting, and it's over. It's vaccine day for baby Lennox, and for his big brother at last too. It goes quickly and routinely, just like the other checkups in this Michigan pediatric practice. But pediatricians like Molly O'Shea are noticing that keeping it that way has become more challenging.
There's a look now, there's a look that wasn't there before. And I'll say, what questions do you have? And sometimes parents will say, can we split them up? Do we really have to do them all at once? I wasn't asked those questions as much 2 years ago.
Dr. O'Shea only takes families who agree to vaccinate their children. So no one is asking her to stop giving shots to their children outright. But she worries about the changing world outside her practice. Last January, the U.S. government rewrote the childhood vaccine schedule. 6 vaccines were no longer routinely recommended. A federal judge eventually struck down the changes. The government's move, says O'Shea, undermines general willingness to vaccinate.
Children's parents who are already at times uncertain about the value of vaccine because they've been given information about vaccine safety that is often confusing or overblown or outpaces the risk of the vaccine compared to the risk of the disease. And when that information is coming from what has previously been a very trusted health source, the HHS director, it weighs even more significantly. And as a result, parents, I think, are coming now with really an unease, a dis-ease about vaccinating their kids.
In 2019, the World Health Organization named vaccine hesitancy as one of the top 10 threats to global health. Then came the pandemic, which turbocharged a distrust of vaccines. Since then, every childhood vaccine the U.S. Centers for Disease Control tracks, for measles, whooping cough, chickenpox, and others, has fallen below the 95% threshold that prevents outbreaks. The pandemic also boosted the fortunes of Robert F. Kennedy Jr., who headed an advocacy group that challenged the safety and necessity of childhood vaccines. Kennedy eventually became the U.S. Secretary of Health and Human Services. He arrived in office with the slogan, "Make America Healthy Again, MAHA." To Rebecca Hardy, he was a welcome choice for the job.
We are supporters of Bobby Kennedy. I keep him in my nightly prayers.
Hardy is the co-founder of Texans for Vaccine Choice, which campaigns for parents' right to opt out of vaccinating their children. Her own children have also never gotten their shots.
I moved to Dallas in the late 90s to attend graduate school. I graduated with my speech language pathology degree as I was setting up my practice. A pattern, I would say, quickly emerged with these young moms coming into my office with their very young children, many of them with vaguely similar stories of their child developing normally, and then they said something happened. And usually they said, after a shot visit with my pediatrician, my child changed.
That claim is a reference to autism. Last December, the WHO reviewed dozens of studies from 11 countries and reaffirmed what it said for decades. Childhood vaccines do not cause autism. But Hardy's movement has only grown. In 10 years, Texans for Vaccine Choice says it helped double the number of Texas families opting out of vaccinating their children and successfully lobbied for many bills, including a law last year making it easier than ever for parents to exempt their children from school vaccination requirements. Last year, measles came back, a quarter century after it had been declared eliminated. More than 2,000 cases were recorded in that year alone. 2 unvaccinated children died. Rebecca Hardy says the outbreaks don't change the argument.
the experiment of liberty, which is America and certainly which is Texas, we need to be open to the idea that some people are gonna be sick, right? We don't get angry when a campus has a strep outbreak. That happens all the time though, right? But we only are conditioned to get angry if it's a disease for which there happens to be a vaccine.
In their own minds, these two women are in the same fight for the health of America's children. The difference is that they cannot agree on the means. Their work reflects the wider debate over what healthy means in America today. For the children caught up in these arguments, the stakes are as high as they can get.
I want to pull in now Eric Feigl-Ding. He's an epidemiologist and a health economist. He is known for his work on global health risks, including his efforts to inform the public during the pandemic. Eric is a familiar face to our viewers. We spoke many times during the pandemic about the virus and the vaccines. Eric, good to have you with us again. And here we are again talking about to vaccinate or to not vaccinate. I mean, if you look at the U.S. Health Secretary, Robert F. Kennedy Jr., he has long been associated with vaccine skepticism. Now the U.S. Secretary of Defense, Pete Hegseth, joining those ranks. What sets public health policy now, medical science or politics?
Oh, medical science no longer is the leading factor in the Trump administration. Politics and ideology and blind faith to political wins is the driving force. MAHA is completely the opposite of what it means because it's trying to make America sicker again. RFK Jr. is not just a skeptic. RFK Jr. is the king of anti-vax. He had the largest organization against vaccines. And, right now, we're running blind. We don't even have a confirmed CDC director. We've fired many CDC directors. We've timed out on NIH has slashed medical research funding. Right now, we're living in a dystopian world where medical research and science just is not a relevant issue. And Pete Hegseth, the recent announcement that the flu vaccine is no longer required is also insane, considering that, half of all U.S. casualties in World War I were due to influenza. And the flu vaccine has been mandated since 1945, more than 60, 70 years. And now we're completely regressed to an era that, we're actually now touting that U.S. military forces, vulnerable to influenzas. It's completely insane, both scientifically and militarily.
What do you think it means when an institution such as the U.S. military, which is built on collective discipline, when it begins to step back from a collective health measure? Right.
And, during whenever any recruit joins the U.S. military, they get a gazillion vaccines because military readiness is key. And if you even think about it, George Washington had previously done variolation for smallpox so that his soldiers would be ready to fight. But for now, us to completely ignore the lessons of history and completely say, well, it's flu vaccines now voluntary. It's insane because, 40,000 people die, 700,000 people are hospitalized with the flu last year. And even if soldiers are inherently not going to die. That's not going to die is not the standard. And we're completely weakening our military, all in the name of politics and bad science-driven politics. This is why this is the weakening of America, not the strengthening of America.
So how do you explain then to an international audience why this situation, this vaccine skepticism, why is it so pronounced in the United States now?
Because it is a cult. This is like pledging loyalty and showing fealty to your cult leader, even though it makes no scientific sense. But in
Eric, where did that come from?
Setting,
where did that come from, though?
Well, it's part of the MAGA movement and the anti-science because scientists during the pandemic, especially it was during pandemic, scientists tried to control us, and, COVID control measures became like a right-wing mantra in which you can't tell me what to do. God gave me an immune system. I don't need the vaccine. And everything from then has further, fueled and spilled over into all vaccines. And now it's become literally a cult symbol of loyalty to right-wing movement, which is obviously very stupid. But it is what is driving this anti-science, anti-preparedness.
And do you think that decisions like we're seeing right now in the U.S. in the Pentagon, will they influence global public health norms or policies?
Well, I think maybe in certain right-wing countries that are loyal to the U.S. Trump administration, I can think of a few. I don't want to name them, but I think for the most part, the U.S., everyone's looking at the U.S. as a laughingstock. And this is not something that, Putin must be very happy seeing the U.S. trying to destroy itself from the inside. So I don't think this is going to make America stronger nor be more respected on the world stage. But I could see a few right-wing governments, adopting this equal mantra. But I think eventually, whenever outbreaks happen, things will come back to roost. And, earlier there was that woman who said, we don't need vaccines. It's okay if some kids get a disease. I just want to remind people. Yeah, like measles actually wipes out and deletes your immune memory of how to fight other diseases. So it's not just like a strep throat. You will actually have deleted your ability to fight other diseases because of a measles infection. So vaccines prevent not just yourself, but also spreading to others and your ability to fight other diseases. And for us to complete for that side is idiocy.
Yeah, I mean, no man is an island, as they say, right? And our decisions have consequences. They go beyond our own bodies, that is for sure. Eric Feigl-Ding, Eric, good to have you on the program. Always good to get your valuable insights into this. Thank you.
Stay safe.
So as you can see, the Pentagon decision has sparked debate about readiness, public health, and how we protect large workforces. So what does the science tell us? William Schaffner is Professor of Preventive Medicine and Health Policy and Professor in the Division of Infectious Diseases at Vanderbilt University Medical Centre. Welcome back to DW, Professor. Let's start with the flu vaccine. How effective is it at preventing serious illness and disruption?
Well, Phil, thanks for having me. And influenza vaccine is a good vaccine. It's not a perfect vaccine. It's not capable of preventing each and every case of influenza, but it really is effective year in and year out in preventing more serious disease. It keeps us out of the hospital, it keeps us out of the intensive care unit, and it keeps us out of the cemetery. So it's important to reduce the impact of the annual influenza outbreak that we see in the temperate zone every winter around the world.
An argument that I've heard from anti-vaxxers, I suppose they'd call themselves, is if these vaccines were any good, we wouldn't have these continual waves of influenza or other diseases. Why is it that these diseases are not wiped out by vaccination?
Well, some of them are, and some of them aren't. It all depends on the science and the nature of the vaccine that can be produced. You were just talking about measles. We got to 0 cases of measles transmitted in the United States about 15 years ago. Unfortunately, because we have not vaccinated every child, measles has come back. We can't quite do the same with influenza. These respiratory viruses, influenza, COVID, respiratory syncytial virus, RSV, those vaccines are capable, with the science we have available today, to prevent more serious infection, even though they're not capable of preventing each and every milder illness. Right. But if you have a vaccine that keeps you out of the hospital, as I like to say, what's wrong with that?
And we heard in the report mention of this 95% threshold that seems to be important. So tell us more about that and what that actually means.
The more contagious a virus is, the higher the proportion of the population that has to be vaccinated in order to keep the illness, the virus, from spreading as low as possible. Measles is our most contagious virus, so we have to have very, very high acceptance of the vaccine in order to keep the virus out of the population. We can't do that with influenza. We're going to, even if we vaccinated everyone, we will have some influenza, but we will have many fewer people having to go to the emergency room and go to the hospital. The real reason we give influenza vaccine is to keep people from getting serious disease, to keep them out of the hospital, children and adults.
And thinking about this decision by Pete Hegseth, when we think of soldiers, we generally think of young, fit people. So does it matter, would it matter, whether within a large body of men and women, a few aren't vaccinated?
You know, it's a little bit ironic. When influenza vaccines first were developed in the 1940s, where were they first used? In the military. Because the military understood that anything they could do to maintain readiness of their population to reduce serious illness was going to be to the benefit of readiness by the military. And so until recently, influenza vaccine has been mandatory, just as it is in healthcare settings. I'm obliged to get influenza vaccine because I work in this institution, not only to maintain my own readiness to provide medical care, but so I don't transmit it to patients. And so it is with the military. The higher the proportion of people who are unvaccinated, the diminished readiness that can be guaranteed. So what influenza vaccine is used to provide the best protection currently available by science to the military.
And what would you say are the most common misconceptions people have about flu and the flu vaccine?
First, I would think that you can get flu from the flu vaccine, which you can't. Yes, you can get a bit of a sore arm for a day or two, but you can't acquire influenza. And then the other is the expectation that influenza vaccine is perfect, that we anticipate that it will prevent every case of influenza. We're not there yet in the laboratory. People are working on making a better influenza vaccine. We should remember what that old French philosopher Voltaire reminded us. Waiting for perfection is the great enemy of the current good. We have a good vaccine that can do a lot of good by preventing serious disease. We ought to use it widely.
It's not often we end an interview with a quote from Voltaire, so I thank you for that, Professor. Professor William Schaffner from Vanderbilt University Medical Centre.